measure that is voting with your feet. I think as we look around this morning, you can understand that people have voted with their feet. They've come here today because I think that the questions that are being framed and talked about, ideas that we represented, were seen as important. I was thinking about my own sort of time with cities, and what is the good city? I think the sort of original kind of notion, a good city is the one that delivers services efficiently and effectively. And so that was in the kind of center ring of a good city. Second kind of thought that began to emerge is one of kind of competition and competitiveness, that a good city needs to compete for residents and businesses. And so I think competition became in the kind of center ring. And the first part of this new 21st century, sustainability, was sort of identified as part of what a good city is, and particularly the kind of definition that included the environment, the economy, and equity. And I think now a fourth emphasis of what a good city is a good city as being a healthy city. And so good city, services, competition, sustainability, healthy. I do want to acknowledge that this region, and particularly in San Bernardino, there has been a number of kind of initiatives and innovations that in this area of healthy cities. I know a number of cities have very active programs, and in San Bernardino, Rancho Cucamonga got an award from the President of the United States for being the best of the kind of healthy cities in the country. And so we're going to hear today a kind of frame around this question of cities and being healthy. And I'm honored to be here to sort of open this up. My name is Ron Leverage. I am a professor here in Political Science Department at UCR, a director of what's called the Center for Sustainable Suburban Development, and was a local elected official for some 33 years in Riverside, first as a council member and then as mayor. This is being hosted by the WRCOG, Western Riverside Council of Governments. The chair of WRCOG is Ben Benoit, now Mayor Pro Tem of the city of Wildomar. There are some 16 regional councils here in this sort of SCAG area. And I'm particularly proud of the good work that WRCOG has done and the consistent leadership that has come from cities and supervisors. Speaking of supervisors, I do want to acknowledge Kevin Jeffries is sitting in the first row. It's good to have you in the first row. And with that, just very quick welcome and thank you for being here, Ben Benoit.
Thank you, Professor Leverage. And it's taken me 4 years to learn to call him Professor. I always knew him as Mayor, and it's just always an honor to be introduced by him. So I want to welcome you here this morning. Again, I'm Ben Benoit, the chair of WRCOG, and I'm glad the professor also took the time to explain what WRCOG is, so I don't have to go down that path either. But WRCOG includes 22 member cities in this jurisdiction of Riverside County, and other local agencies. But our partners stretch far beyond Western Riverside's borders, and I'm encouraged to see so many of you here today. We strive to work with our communities to help them think about their long-term vision for our future. What decisions can we make that now help create an economically sound quality of life for residents 20 years from now? Who are we planning for? What can we do as leaders to encourage our kids to stay here in the future? These are questions we hope to answer today with the expert lineup of speakers. And as I look back on coming to this building for the last 5 or 6 years that I have for different events, I look at the future technologies that have been produced out of this area. For instance, when I first came here 4 years ago, there wasn't a large-scale solar field in the parking lot. There weren't a bank of chargers that now when I pull in with my chargeable car that are almost full. I got here today in a car that still had 10 miles of electricity or 10 miles of range on the fully electric, something I couldn't have done just a year ago. The future is coming faster than we think, and the future is now for our cities, and we have to be planning for that future. Good cities like Riverside plan for that future all the time, so they could seem to see some of those future things coming faster than others. Other cities might wonder, well, we'll find that later. Well, a lot of those things are out there now. Hydrogen is coming quicker than we would probably all think. The hydrogen station here in Riverside finally came online this January after a lot of frustration to try and get it there. But I can tell you that if you don't start planning for those things now, they're just going to come and hit you in the face later when the council members are yelling at staff or yelling at someone else, why isn't this here yet? Why do those other cities have it? So I look forward to hearing from all of our panelists today. And as a mayor pro tem for my city, I know that I need to be looking towards the future, and I hope we all do too. Thank you again for coming here today, and we'll can't wait to hear from all of our great speakers. Thank you.
We now have an opportunity to hear from the two CEOs of Riverside County and San Bernardino County. I spent last night hosting an intern dinner at my house, and it was interesting listening to what students know about counties, which is not a whole lot. Counties do many things with their 20,000 plus employees, with $5 billion in budgets. One of their kind of directions is to worry about health. It's a complicated and important matter, both in terms of service and measurements of what's happening in the county and different places in the county. First, to introduce, and we're not going to spend time with the long biographical introductions that are in your program, and you can get a quick understanding of that. Will be Greg Devereaux, the CEO of San Bernardino County. But before Greg comes here, let me just acknowledge that Greg has, in effect, announced his retirement, and so this year will be the last year. What's the date you said, Greg? March 31st is the end of his time. If I had to put together a top 5 list of public servants in California, Greg Devereaux would be on that list. Extraordinary life dedicated to public service, and it's really my honor to introduce to you the CEO of San Bernardino County, Greg Devereaux.
Well, I could have well been one of those interns at Dr. Leveridge's last night, because as a city manager, certainly I knew very little about health or the role that it played in our community. And I'm ashamed to say that for a long time, I was one of those city managers that when someone came to talk to me about things like health or education, I often said, oh, no, you don't understand. There's a Board of Education. You elect them. That's not our job as a city. You need to go talk to them. Or if it was health, I would say, no, you don't understand. That's the county's job. You elect a supervisor from this area. You need to go talk to that supervisor. I was wrong. I was wrong. And part of what helped teach me I was wrong is when I went to the county, I looked around and I said, there's really not an overriding direction or vision for the future of the county. Now, every city develops that kind of direction, if no other way, through the development of their general plan. When they develop a general plan, they engage the community in order to say, what's the future of the community we want? What kind of community do we want to be? And so they have some sense of a vision that they can then direct their resources, use to guide their resources and their allocation of resources to try to work toward that future. Well, counties have general plans too, but the county general plan only has to do with the unincorporated areas. So where's the vision for the entirety of the county? And in truth, there was none. So the board supported getting together with our Council of Government, Sandbag, and we worked on creating a vision for the whole of the county. So we went out and engaged the community, we engaged stakeholder groups, lots of experts, and created a vision. And that vision had elements that were necessary to see it to fruition. So education, healthcare, housing, transportation, the economy, all of those were elements that had to be addressed in order to bring that vision to fruition. Now, how that ties into my earlier statement is that all of those things are interrelated. But more importantly, they are interdependent. One area can't succeed without the other. You start to realize what I didn't realize as a city manager, that all of those must succeed in order for any of them to succeed. So if you want well-paying jobs, then you've got to have an educated workforce. If you're going to have an educated workforce, then you have to have kids that are healthy enough to be in school and pay attention in school. If you want certain kinds of tech industries in your community, then you have to have living environments that will attract the workers that those industries need. So all of those elements are not only interrelated, they are interdependent. And because they are interdependent, then all of us in all sectors have to care about all of them and work on the success of all of them. And that's really what we've been doing in San Bernardino County. This commitment to a shared vision has led to much more collaboration and cooperation and working cross sectors from all sectors of the community. First major effort was Community Vital Signs. Community Vital Signs was a cross-sector effort to determine what were the primary health issues in the community that we needed to address, working together in a collective action kind of format to develop plans to address them. Our healthy communities fit right in with that because, once again, you've got to be working across sectors to address all of the kinds of issues, whether they are planning issues, walkability, transportation, that all of that takes the entire community. So efforts that have come out of that, out of healthy communities, Community Vital Signs, have led to things like our most recent effort, which is Vision to be Active, as part of our overall work on the county vision. We had a program last year, Vision to Read, that resulted in tens of thousands of more visits to the library, books. We've got to engage the community, the entire community, in these efforts. As part of Community Vital Signs, they clearly identified that that heart disease was the issue that everyone could coalesce around and work together on. And it is that kind of collaboration and collective action that will move us forward. We as counties, whether it's Riverside County or San Bernardino County, have far too few resources to be able to address any of the major issues in our communities in silos. It is only through all of us working together that we will be able to address any of them. The kind of effort that we have seen recently, our behavioral health department, our county hospital, and public health department have come together on an effort, Whole Person Care. The Whole Person Care effort is really looking at the top 500 highest utilizers of county health services within the system. Those top 500 cost over $17 million. So Whole Person Care really is employing a patient-centered approach to care coordination. We didn't used to have that kind of coordination where we're using mobile outreach, patient navigators, nurse care managers, clinical therapists, social workers, all working together, sharing information, sharing data in order to take care of that person and reduce costs. Partners in that effort are the sheriff, Aging and Adult Services, Housing Authority, IEHP, and Molina are all participating because we all have come to understand that it's only through those kind of joint efforts that we will be able to reduce the costs of healthcare going forward. And it gets at the heart of one of the most difficult issues in government in the entire United States. And that's, how do we take downstream savings to pay for the upstream interventions that create them? We have still not figured out as a country how to unlock that, but working with groups like IEHP and Molina, there are serious efforts to figure that out. If getting someone housed then allows you to provide them the services they need in their home, instead of being chronically homeless on the street and being one of those high utilizers, then we have to figure out how to use that healthcare savings to fund getting them housed. I'm tremendously excited because this level of collaboration and cooperation to try to solve that kind of problem will provide long-term benefits. The other thing that we're seeing in all of that is that we have to spend far more time and effort getting both incentives and risks aligned. My good friend Jay Orr has led an effort to create a clinically integrated network within Riverside County. We're doing the same thing in San Bernardino County. And that effort is in order to be able to share information, share risk, and share the benefit of if you are able to control those risks and control those costs. There is enormous progress being made in both of our counties, and whenever we have an opportunity, we work together as counties in that same spirit of collaboration. Thank you for allowing me to talk with you today. I know these are weighty issues, and these are especially weighty issues as healthcare in this country continues to evolve at a rapid pace. Because of that rapid pace, the only way we will be able to deal with healthcare is collaboratively. Thank you so much for your time.
Next will be the CEO from Riverside County. Just a couple quick comments. I remember as mayor, that I had some representatives from the Heart Association came to see me, and they began to talk about the data of these two counties and how we were in the top 10%, the highest in terms of heart attacks and strokes. And if you ask yourself, what what's the objective of the good city? It's to make life better for its residents. It seemed to me there's kind of a moral imperative that you want to worry about enhancing, improving the health of people who live in your city. I've always been impressed with Jay Orr's concerns for making differences, measurements, not simply taking inventory of what the data is, but trying to find answers and interventions. And so look forward to his comments. Jay Orr, CEO of Riverside County.
It's always my pleasure to come and speak with Greg. Last time we spoke together, we were at a UCR Economic Forum in San Bernardino County on a panel, and I really appreciate Greg. I want to say that because it's not going to be the last time that we speak together. We know that, even though Greg is retiring. But he's been an immense help to me in my tenure as the CEO of the County of Riverside. I know soon when I got the job, and actually when I was in the number 2 position, I met with Greg often to bounce ideas off him. And I have the privilege of also speaking with other CEOs throughout the state, and I find that we're all dealing with similar dynamics and similar issues throughout California. I think ours are a little unique in the Inland Empire, and I want to talk about those. And so thank you, Greg, for teeing it up. First thing I want to say is this, and you need to be aware of this, is that 72% of the counties in California are worse off today than they were in 2008. And I remember in 2008, I was not in the seat I sit now. I was in the number 2 seat, and I had just become what I thought was the best job that I ever had, even though it was not this job. Okay, so the best job I ever had was being number 2. The bomb blows up, and we have 2008, the Great Recession. All the rules are thrown out. You're drinking from a fire hose. You're trying to figure out how are we going to go forward and make Riverside County a better place. And I think for about 2 to 3 years we were distracted, and all counties were distracted from the recession, and we tried to find our way after that, and we're still trying to find our way as we move forward. As I stand here today, the state has pushed down mandated costs to counties that are overburdening counties in so many areas. So I don't know, I got a boss here, and so he has a sense of humor. I told everybody when I got to be 60, I was going to say a bit more than when I was 59. So I'm going to be 61, so you're going to get a bit more. And that's this. And it's not politics, but it's a fact that there's state mandates that are pushed down on counties, and counties are the yo-yo on the end of the string that are having to deal with change all the time without getting the funding to implement those changes. And what counties do, they're a political subdivision of the state, and you have to deal with all the mandates that the state give you and all the government code issues that are there, and all the health and safety code issues and the welfare and institution code issues, and you have to make it work for America. It's at the county level where things happen. It's not at the state level. It's not at the federal level. It all flows down to a county, not even to a city. When you actually look at what cities do, and God bless cities. I live in a city, and cities are great places. But it's at the county level where you have to deal with the health and the human services and the criminal justice systems, transportation systems. It all comes to a county. And a county can't do it all without collaborating with cities. So it's going to happen at the local level. It's not going to happen at the state level. So I have to say that. And then counties can't be the yo-yo where we change policy even at the federal level every 4 years, and we have to deal with that. And I'll talk about that in a second. And it's not politics, it's just that yo-yo effect. But when I got this job in 2012, I had to look at the county and look at the data and think about the quality of life in Riverside County. And I've been a Riverside County resident for nearly 30 years. And I decided that we needed to be the safest, most business-friendly, and best place to live in America. And how do I say that with all honesty and integrity, that this is and can be the best place to live in America. And I came from a coastal county. I came from a county where I had a window looking at the Channel Islands. But I said to my wife after being here for about 10 or 15 years, "Are you glad we moved here, settled here, and raised our kids here?" And she said, "Yes." Because this was a better way of life. It was more whole. It was more realistic than actually living in a coastal county. When it came to what values are in America and what you want to be as a family. But I announced those goals knowing that we're not the best business-friendly county in America. So let's try to be the best we can with business, because we need to improve. Let's be the healthiest county we can, because we're not. We're in the bottom third of mortality and morbidity. And that was explained to me. That's not a good place to be. I'm a competitive person. I don't like to be at the bottom. We're at the bottom. And then I understood that if we're at the bottom when it comes to income, and if we're at the bottom when it comes to education, and we're at the bottom when it comes to health, we're not going to go forward as a very strong economy. And my bosses would say, "Well, how come we can't get high tech here? Why can't we get high tech here?" Well, because we don't have the education, we don't have the workforce, and we don't have the health. So we need to work on those things collectively. And you find out that everything is interconnected. And that's the other big challenge we have in Barrier, is to get rid of siloed thinking in cities, in counties, in states, in society. I deal with it all the time, siloed thinking. Mandated funding dictates siloed thinking, and people think in their silos. You don't live in a silo. Think about your own body. I stubbed my toe, too much information I know, a couple weeks ago, sprained my toe, right? It's just my toe. I limped for like 2 weeks. It was my toe. So think about it. The littlest things in your life can really throw you off. So you worry about your brain health, you worry about your heart health, you don't worry about your toe health, do you? But when it happens and you live in this siloed thinking, you realize it's all integrated. The same is true in government, if you use that analogy. Everything is interconnected. And we really need people that are forward thinking and get out of their silos. So I want to talk about that. So what's going on in America today? We need to be forward thinking because the demographics are changing. The largest portion of our population in Riverside County are adults 18 to 64, 60%. From 2000 to 2016, Riverside County's population has increased by 52%. So whether you're a city or whether you're the county, think about what burden that puts on your infrastructure and service delivery, 52%. Over the next 13 years, we expect the population to increase close to 3 million people in Riverside County by 2030 and over 3 million by 2040. We're not the county of dirt, okay? I've heard that expression the other day. That's so infuriating. That's so irritating. I was just talking to Greg. I'm going to say this. I'm going to get in trouble. I told him we need to take our transportation departments, put all our trucks on the 10 and the 15 and block it. And we will get the United States' attention, because over 25% or more of the goods from the ports from Los Angeles flow out of the two counties. You realize that? How important we are to logistics and the economy of this country? We're big, and we need to start acting like we're big and talking like we're big. Americans are now more racially and ethnically diverse. In Riverside County, 50% of the population is now Hispanic. In 2000, it was only 11%. What does that mean for us? What does that mean education-wise, health-wise? Changes in power structures, changes in democracy and our participation in democracy. How's that going to change our future? How should we prepare for that? I've talked to the Hispanic community. There's work to do in education. There's work to do in health. There's work to do in chronic disease prevention as they take the reins of power structures and participation in democracy in Riverside County and the state of California. The boomers, I'm a boomer. I see a lot of boomers in the room. We're leaving. We're retiring. We're moving on. So what's that mean? We're going to have to deal with millennials. Ooh, they're not boomers. They don't think like you or me or you. I can see who you are. They act different. They're getting married later. They're purchasing homes later. They're having families later. What does all this mean for us? We need to think about it. And yet they're strapped with a lot of student debt. And we told them all to go to college and get good jobs, which they're trying to do. And they're doing it very well. But they're strapped with that debt. How do we deal with that? How are they going to move forward in the economy, an economy that was very housing dependent? Let's talk about poverty. In Riverside County, you need to know this. 1 out of 4 children are living in poverty. That's unacceptable to anyone in this county. 21.8% of the children in Riverside County are food insecure, which is defined as having limited or uncertain access to adequate food. I know that just from the statistics, but I know that because my wife is a kindergarten teacher, and I know the percentage of kids that get free food and free lunches at school. And you can say, well, good, they're fed at school. But you know what? You got 20 minutes to get that child from the kindergarten class in and out of the cafeteria, and they probably only have 10 minutes to eat, and they're food insecure, and the anxiety comes out, and their learning's affected. That's what you're dealing with in your educational system. So in general, Riverside County has higher poverty rates compared to California and to the national averages. Let's talk about housing. We've been big on housing. We've built a lot of housing. A large amount of people who rent in Riverside County spend 30 or more % of their household income on rent, 61.2%. We were talking about the housing assistance wait list yesterday at the board. There's 61,000, almost 62,000 people on that list. That's a lot of people. Here's a fact that I struggle with. 20% of the households in Riverside County have 4 or more ACEs. Now, you probably have no idea what that means, ACEs. Anybody know what it means? Adverse childhood experience. There were 2 doctors in this country from CDC and Kaiser that did a study. And that study was with middle class and upper middle class adults in San Diego County. And it looked at your life and your experiences as a child. And it's not necessarily child abuse, but extreme poverty, breakup of the family, all these issues that go on in families. And if you scored 4 or more, you're going to have a worse health outcomes as an adult than somebody that doesn't have that score. In other words, it's a predictor of your adult health. And therefore, your life expectancy is going to be less, and the quality of your life is going to be lesser than other people's. Having that statistic is not good for adult health. Now, I know most of you probably don't read the Washington Post, okay? But I get it on my phone, and I get pushes from them. So article last week that said the life expectancy in the United States just ticked which direction? Down. Did you know that? Did you hear that? It went down. It didn't go up. Why in this country, of all the civilized countries, when you look at health care and how we manage health care, whether you're for or against whatever we're doing in the federal government, and we don't know what we're doing yet, they've even told you that, okay? We're going to repeal, but we don't know what we're going to replace it with, but we don't like this one, but we don't know where we're going. All we know is this, okay? We have one of the worst systems in the civilized world. We spend more and have some of the worst health outcomes. So if that's the case, we need to spend not necessarily all the money on access to care, we need to spend the money on preventing the need for care. And if you're going to prevent the need for care, you need to have safer communities, you need to have access to healthier food, train people to make healthier choices. They're going to make the choice on their own. We don't want to become a diabetic nation, and that's where we're headed. And those millennials and their children will have a lesser life expectancy than the boomers in this room. And if that cycle perpetuates itself, you don't have a sustainable community. It's all about the economy. It's not about making health as the goal. It's about making sustainable communities and a sustainable society. I'll wrap up by just saying this. We need to be all in this together. Cities, counties, and we need to go to NGOs, community-based organizations. Don't be afraid of going to faith-based organizations. And everybody needs to share the burden. It's not just a county burden. Cities need to understand if they're going to be profitable, sustainable communities, they need to take this burden on as well with counties. Share the cost of it. It's all our residents. When people come to your city, what do they ask when they want to move there? A new person. I know what they ask because I know what we asked when we moved to Corona. I live in Corona. Where are the parks? Where are the schools? Where are the trails? Where's the library? Where's my church I'm going to go to? Where's my neighborhood? That's what people ask. They want to be part of that neighborhood in a sense of identity. That's what they ask us as public servants to build for them and create for and help stimulate. They'll build it, but to stimulate it and partner with them. Government shouldn't be afraid of partnering with other people. Get out of our silo. Sometimes they'll do it better, sometimes they'll do it cheaper, and sometimes they'll tailor it to their particular flavor or need. They'll know. So we have a lot of challenges. People are doing the right things. We need to focus, as my friend Greg said, and I agree, on collaboration. We need to get out of our city, county, NGO, municipal, organizational silos and work together. We need to shift the way we reach people and communicate them to include every community. We need to be sensitive to their needs and listen to them and create the sustainable environment that's attractive. Because if you're attractive, people come. And that's what we want to be. So I know you're here to address those things. Thank you for letting me pontificate a little bit. And if you have any questions, I know Greg and I will take any questions. Greg, you want to come on up? You have any questions for us? Probably not on the agenda, Jennifer, is it? No questions? All right. Thank you very much. You do. Great. Work in health professions. If you look at our economy, we've grown in health. Both economies have. So because boomers are retiring, there's going to be a lot of need for health care. Most of health care, 80% of all health, if you're talking about health care or even health management, anything related to health, most of the spend is in the last 10 years of our life, right? So hopefully we're not there yet. But 80% of health spend is there. So if you're really thinking about health, just follow the dollars, follow what's happening in society. There's going to be more and more need for health jobs. That's booming in both counties, whether it be public or private sector.
So when you say health, what aspect? But what, as a caregiver, as an administrator, because I think the advice is different.
You know, I get that question, and I always have to tell people, okay, neither one of us got to do policy when we were young. We got to do it when we got to be older, to be quite frank. It doesn't mean you shouldn't study policy. We're both lawyers by trade. We've been studying policy since we were young. But you have to kind of go where the job is, and you have to kind of be flexible and understand that there are jobs out there, but it might not be the one you want, it might be in the location you want, and it's a journey, and you'll get there.
I think that Jay's original advice about looking at the resources, so if you're really interested in policy, looking at the need and the demographics and the changing need and the resources, the conjunction of those two is where policy is going to be needed and made. I think there was one in the back.
Yes.
Well, I certainly agree with you, and I apologize if I came off negative because I certainly didn't mean to. I think there is more collaboration and cooperation going on in our two counties today than any time in history. And it is leading to things like whole person care and clinically integrated networks that are incredibly positive steps forward. So I certainly didn't mean to come off negative, and I thank you for bringing that up.
Well,
So he was negative.
I was negative. I like to say I'm trying to be a realist. But as far as the
I was
collaboration-
much more positive.
Yeah, as far as the collaboration goes, and I joke about this, public health is the most collaborative department that we have in both sides of the county. And we have great things going on with Harupa, because I know you're with Harupa. We have great things going on with the city of Paris. There's great things going on with the city of Riverside, Corona. I mean, it could go on and on and on. It's pretty amazing right now in the area of health.
Doing anything to collaborate between the regional hospitals and the education, the universities and colleges?
Yes, we are always training doctors, both of us, and interacting with the universities.
Dr. Dora Barilla, who I think is on the first panel, will be talking a lot about efforts to link up the healthcare institutions and the colleges and universities to make sure that the pipeline is there. So she'll talk a lot about that. Thank you.
Hey, Ron.
Let me acknowledge the question that came from the rear of the audience was Laura Rowden, who's on the City Council and Yarupa Valley, who's been very active and healthy. Yarupa Valley has attended many of the kind of healthy Riverside County meetings that have taken place, and would acknowledge her important leadership in these efforts. We're sort of now moving. We've had the kind of frame of working together, of the kind of profound challenges that are before our counties, our region. We have three panels, really exciting panels. The first is the future of community design, and I would like to invite on stage the moderator, a longtime friend and person who's committed his life for better health here in Riverside County, Michael Azur. Official title, I think, is Assistant Director and Chief Health Strategist for Riverside University Health Systems. Michael, please join us. And the speakers, Al Zelenka, Assistant City Manager for the City of Riverside, Eric Calloway, Senior Planner for Change and Lab Solutions, and Dr. Dora Barilla, President and Co-Founder of HC2 Strategies. Join me in welcoming to the first panel.
Good morning. Yay. One thing works. Imagine what it's like to follow Jay Orr. He lives and breathes this. I get a call almost every day and every night and emails throughout the day with ideas he has to help make our communities better. And we're working now, for the first time since in my career, very collaboratively with Riverside Public Health and Riverside County Public Health and San Bernardino Public Health. Because we always say we have this 200-mile long border, and it's not the Berlin Wall or something, which is, for the millennials, I'll explain that later. But you don't need a passport to go back and forth. And we have to work together because the issues are the same. They'll always say they're completely different, but the issues are exactly the same. And to even give more perspective to what Jay said, San Bernardino and Riverside rank, the two of us together rank dead last on the physical environment conducive to health. And that's really sobering for me. One of the main reasons is because we all drive alone to work. We don't take mass transit. And Jennifer and Andrea did a great job. All of you have a free Metrolink pass, free round trip. You can go to Union Station. And you have a discount for RTA. So we can actually change our numbers by all of you using those passes in the next month or so. Thank you, Jennifer and Andrea. So we have this amazing panel, which you briefly heard about. Eric from Change Lab, which is I call it a think tank up in Oakland that's changing the world. Dora Barilla, I've worked with for 2 decades. She has this fancy title you can read about in the program, but she was way ahead of the curve on getting communities to work together to improve our health. And Al Zelinka, who's a mentor to both Miguel Vasquez, the health planner for the health department, and me, and I'm still the only person that bought a case of his books and got him to sign them all. I might have a couple more. So to start with, Eric's gonna set the groundwork for what we're gonna be talking about. Eric has the broad perspective, and he wants to talk about health and planning and how we got to where we are. Is that right?
Oh, thank you. So when we talk about this vision of a future of healthy communities, I think it's important to first just kind of state the obvious that where you live affects your health. So both planning and public health, as we've heard, are starting to rediscover how important place is in determining how healthy a lifestyle that you can have. And that's partially because you spend maybe, 30 minutes a year at the with your doctor. And the other 365 days a year, 24 hours a day, 7 days a week, you spend outside the hospital, at your house, at your workplace, at school, at parks, getting groceries, running errands, eating, with your meals, and going from one place to the other. And so these environmental factors account for up to 80% of our health. But then what's important for us today are what are the factors that shape the environments that we live in? How did those environments come to be the way they are to affect your health in these different ways? And in order to do that, it's important to take a bit of a step back and go back to the turn of the century and industrialization, which in the case of Riverside and San Bernardino counties would be essentially before all of the urbanization that we see here. And at that point, we were seeing major changes in the way work happens, where we shifted from agricultural physical labor to industrial assembly line labor, which was low skill. It was organized along assembly lines and synchronized. And the result of that were 2 main things. We saw widespread urbanization, and we got a mass production, mass consumption society. And at the time, around the 20s and 30s, city planners saw this tremendous prosperity that was being generated and identified these new technologies of the time, and they specifically reorganize cities using industrial principles. So they created this new way of planning and building cities where they broke cities up into their component parts like assembly lines of living areas and working areas and shopping areas. And they connected them with the conveyor belts of roads to accommodate the new technology of the time, the automobile. And one of the reasons for that was to do a better job of separating dirty industrial workplaces from housing areas, which was a health issue. And then other reasons were to plan cities based on the lifestyles and the technologies at the time. And we invested heavily in that way of planning and building cities, starting with nationwide highway and street networks. And we literally paved the way for mass-producing auto-oriented suburbs, starting with housing and then with office parks later in the 80s and in the 90s and 2000s with regional shopping centers. And so we saw a lot of prosperity. It was a very successful way of planning and building cities. But we also saw that prosperity unevenly distributed for a wide variety of reasons at the policy level. So FHA-backed lending policies, redlining, and then where we invested in those different types of infrastructure and services, and how we planned one community versus another community resulted in economic and racial and socioeconomic segregation. And we see that reflected in our health outcomes as between different regions, between different cities, and even between different neighborhoods in the same city, we see significant disparities in chronic disease rates and life expectancy. So we're still planning and building cities using that same paradigm, but the world that we live in is totally different than it was back then. So we need to take that into account, that now, instead of industrialization, we're living in a world of digitalization, and the trends and the lifestyles are totally different in terms of we no longer so structured 9-to-5 work days. People check your email before you go into work. You stop and you take a coffee break. Maybe you go to the gym in the afternoon. You work a little bit later. There's a lot more demand for walkability and just more generally transportation options, and specifically surrounding convenience. And we see that reflected also in demand for certain types of development, infill development, transit-oriented development, town center development, as opposed to power centers or auto-oriented office parks. And we see a lot of demand for public space and street life and city activity. So as we heard earlier, we've seen this incredible amount of growth in the San Bernardino and Riverside County areas, and the whole LA region had the top 5 fastest growing counties for 30 years, and they're projected to be the top 5 fastest growing counties in the nation for the next 30 years. And so if we can get out in front of these trends with all of this growth, we can transform our communities to be healthier. And luckily, the trends of how people's lifestyles are changing aligns with what healthy communities are. So clustered dynamic mix of uses and transit-oriented development and public space for convenience, recreation, and exercise, and equitable housing that provides lifestyle options, safety, healthy food systems, access to healthy food, job access, and quality schools are all things that both, as we heard earlier, people are looking for in the communities that they live in, but also support healthy living.
Thank you, Eric. So Dora, tell us about your work and we want to get future-oriented here. What's your vision for the ideal future communities?
Well, thank you, Mike. But I'm going to go a little bit to the past, and then I'm going to just for a minute, because I think it has context. It was just so life-giving to hear Jay and Greg this morning. I almost feel like my work here is done and I can go and retire with Greg, because I think the tipping point has happened and the mental model has changed, and the future of the Inland Empire is going to be phenomenal, and I'm really excited about that. But I want to share just kind of what brought me to the work, and because I think that's really important in terms of context. I'm a 5th generation Californian. I grew up in LA County, and I actually attended Pepperdine and got a degree in sports medicine. And I came out to the Inland Empire when I was 22 years old. And my husband and I raised our kids and really built a life here. But when we first came out, I've worked in healthcare for the past 30 years. And when I came out here, I was asked to be the director of preventive care for a large MSO, which is a managed service organization, doing managed care in the early 90s. And my job was to help reduce chronic disease of patients that were, living here in the Inland Empire. And I was this idealistic 22-year-old who thought, we'll tell them to eat right and exercise, and that's going to work. And I'll never forget a Friday afternoon, I get a stat health education consult. And so I drove out to visit the 16-year-old girl who was suffering from type 2 diabetes. And I had my traditional mantra, and as I got off the freeway, there weren't any sidewalks. There were fast food restaurants on every corner. And I probably wouldn't let my dog walk. And I was going to go tell her to get out and exercise and eat fruits and vegetables. And when I sat down and talked with her, she mentioned that, she'd had some sexual molestation and all sorts of really issues dealing with poverty and living in an environment that wasn't conducive to health or actually flourishing as a human being. And that was really instrumental. It was my tipping point where I said, there's something so much bigger than this. And so really began looking at the larger picture in terms of how do we impact health? And I had a little bit of a self-realization that healthcare was really a very small part of it. It's important, yes, we need hospitals and we need clinics and we need physicians and providers. But if we're really going to produce health, that we needed to look at this from all the different sectors. And really began the conversation of how do we get all the sectors involved, because this is about transportation, this is about policy, this is about whether or not we have food, good food to eat. And really saw the Inland Empire through kind of a different lens, just being a fifth generation, that I had the greatest running trails in the world living in Rancho Cucamonga. We had all this land to grow fresh food. So many opportunities. We had universities everywhere. How do we pull people together and really shift our thinking and our vision of what we could be? And that really has shaped a lot of the conversations, in terms of moving this forward. I've been involved in a lot of the conversations, and I think there's a whole team of people in the county now, in both counties, really having the conversation, working on this. I would not be sitting here talking to a group of cities 20 years ago. So this is exciting. And I hate to say that my work in healthy communities and working with cities has probably produced far more results in terms of health improvement than my 30 years in healthcare. So I now work with, I started my own company 2 years ago, and so I am now leaning in with the largest health systems in the country into cross-sectoral health improvement. So I work in 8 different states. And so my office is in Rancho Cucamonga. Lots of economic development and lots of opportunity here. And I think, the key is how do we begin to work with all the different sectors? So what's really exciting is, we're really being a catalyst for these conversations all over the country. This is what everyone is looking to do. And they say, Dora, how do you have cross-sector health initiatives? People don't talk the same language. But we have to start, so if we're looking at what's the future, a couple of really, I think, key opportunities. My company just started a joint venture with the Hospital Association, and we'll be building out the community health improvement arm of the 181 hospitals here in Southern California to really look at how do we begin to lean into health improvement in a cross-sectoral way. And so I have full intention of working with the Inland Empire and really helping to, I think, be a catalyst for some of the great conversations that are already happening, because I think what we know is there's no one person that can do this. This really takes everybody. So as we look at what is the future of healthy communities, one, I think it's leadership. I think if I was to go back 20 years, I'd say I would have spent a lot more time on more visioning and mental models. because I didn't realize I was a futurist and a connector until I was into my 40s, and really realized that I saw connections that other people didn't see. And so I think the future really is creating venues to have the conversations, and then really working in and leaning with all the different sectors and seeing how we can collectively improve healthcare. So, open up the door, have invitations to sectors that you didn't think, wanted to have this conversation, because they need to and they will. Just like Greg said, the solution to some of our healthcare challenges are really sitting in this room today.
And Dora's also done a lot of work in helping train the next generation, and through the Randall Lewis Health Policy Fellowship, now it's Maggie Hawkins is helping with that. Can anybody in the room who's been a Randall Lewis Policy Fellow stand up and we can give you a shout out? I see some of you here, Diane. Because we need to make sure that we train the right people that are going to stay in the Inland Empire to make it a better place. Now, Al, didn't you come from Orange County?
I did. Is this on? I did.
What's your vision for? Tell us your vision for the future community. You're building it as we speak right here.
So about 5 years ago, I joined the city of Riverside, and it's been one of the greatest gifts I've ever had professionally and personally. This city and the region in which it's located is truly a place that has the greatest potential and the greatest value proposition, if you will, in all of Southern California, bar none. When I started here 5 years ago, the first week or two, I can't remember exactly, but I was on a pre-scheduled Urban Land Institute panel called Development on the Edges. And it was based, this panel, it was probably a room about this many people. It was based on a view coming out of the recession, trying to come out of the recession, and what the opportunities are going to be in the greater Southern California area. And I remember sitting up here with some folks, and I happened to be, originally I was going to talk from an Orange County perspective because I was with Fullerton, but then all of a sudden I had better value because I was now the token Inland Empire representative, and to the panel who are all Orange County based. And I'll never forget this huge graphic they had up, an aerial, showing the coast and the Inland Empire with these radiating half concentric rings from the coast outward to Riverside and the Inland Empire. And I remember my first comment was, I've already learned in my first 2 weeks that if you would have given this map to the folks in the Inland Empire, the rings would be different. The rings would emanate to the coast, not from the coast outward, because this place out here in the Inland Empire knows what it wants and knows what it can be. And it's not Orange County telling us what we want to be and what we're going to be, even though many of the developers are based there. So tying with what Eric said and what Dora said and what Jay and Greg said, one of the things that I see, at least with Riverside, but it's connected to the region without a question, is the silo idea. Many of our systems, whether it's transportation, land use, public health, et cetera, have been built in silos. We all know that. And they operate to this day, less so, but they still operate in silos. And we're all working to bust those down. Probably 15, 20 years ago, when Michael and I first met through the New Partners for Smart Growth Conference, that was one of the first times where every discipline came together in a mashup to start busting down professionally those silos. We're starting to see that manifest now in the way that cities and counties and regional governments, et cetera, are starting to operate. Those silos are busting up. Here in Riverside, take a moment sometime and look at a Google map. Very few places have what this city has, which is bounded almost completely by open space, whether it's hills, whether it's greenbelt agricultural land, or whether it's a wild Santa Ana River. We've got it here in Riverside. Laguna Beach is surrounded by a greenbelt and ocean. We're surrounded by a different greenbelt, different complexion. We also have a great downtown. We've got a great transportation network, rail, freeway, et cetera. And we also have a complete selection of neighborhood types. Anything you want can occur here in Riverside. But what we have is, you think about where we're located right now, it's perfectly in this industrial model that Eric was talking about. There's no reason in the world why this parking lot shouldn't be infilled with high-density residential development within a stone's throw of the Metrolink station in Hunter Park, and people who live there can work here. This isn't dirty industry here. People should be living here. Mayor Bailey has been starting an effort in Riverside called an innovation district. And basically it's a large area, this area is bordered by, which is taking a look at this mashup. Why do we have to separate all this stuff? Why can't it all blend together as long as people's health and safety are looked out for? And so one of the things that that Riverside and that's being led by the city manager's office, but I'll tell you, it's just taken wildfire throughout all the departments, something called Streamline Riverside. And we've all heard of Streamline, cutting out the red tape, all that kind of stuff. But this is real, because much of the regulations we have in place are actually preventing, as well-intended as they are, they're preventing the entrepreneurial spirit from creating the places we want. There's too many hoops, there's too many risks, there's too much nonsense built into our regulatory frameworks. And so I know a couple of my colleagues at a minimum are here, Rafael Guzman and Ted White. They're amongst the folks here at the city that are blowing that up. And is it catching fire? Yeah, it's catching fire. We've got more good development lined up than we've ever had in at least the last 10, 15 years. It's catching fire so much that places like Austin, Texas are starting to call us and saying, hey, what are you guys doing? We want to learn from you. And so what all of us are doing here in the Inland Empire is actually creating new models for doing things differently and breaking up silos, new systems, so that the outcomes are manifested here. One other point, and then I'm going to zip it. Less than a couple weeks ago, one of my colleagues, Ted White, brought to our attention an LA Times article. It was all about LA and all the apartments that are being built within 500 feet of freeways. Basically says 2.5 million, so that's about 10% of Southern California, is in this bad air quality zone, right? So what gives? Probably most of you in this room, maybe I'm exaggerating, but certainly many of the people in Riverside, they don't want that high-density housing near their single-family homes. So what gives? Where does it end up? It ends up by the freeway corridors, because nobody cares about it over there, right? But then we're in conflict with the public health challenges of our day, and which we already heard about. So this mashup that Eric's talking about and re-examining the way we do land use and transportation is fundamental, bottom line to public health in the Inland Empire.
Remind me later, I want to talk about these parking ratios that's keeping some of that that high density. You need to blow that up, because that's the biggest impediment.
Jason Pack out here, Fair and Piers, has been helping us. So.
Thanks, Jason. Eric reminded me I didn't give him a chance to talk about his vision because he was laying the groundwork. So Eric, a few minutes.
Oh, not necessarily vision so much as just kind of building on what we've said here since my first comments were very global. Is I think to kind of dive into some real hands-on how to make this happen is there's this. We've heard a lot about collaboration, cross-sector collaboration, making sure that everybody's involved, getting everybody to the table. And I think one of the things that I've seen and experienced with my background is in urban design and land use planning. So doing a specific plan for a community, scheduling the workshops, planning what happens at the workshops, scheduling a meeting, what we call a core team meeting, which involves representatives from the planning department and the public works department and economic development department and the mayor's office. And that's not even to say then when you get the draft ready and it's reviewed by the fire department and the police department. And all that takes a lot of time. So even if you get everybody on the same page, you're all in this room and you're like, yeah, we need to make our communities healthier and we need to rethink how this happens and we all need to get to the table and talk about whenever we're doing our plans and make sure that we integrate these ideas. And then you go back and you're like, when am I going to have the time to do that? Who's the one who's going to make the agenda or schedule this meeting? We're all really busy. So I think that one of the really important things that I would ask that maybe people take home is think about how you can build capacity in whatever organization that you have to dedicate time and set aside the time to do that work of, say, like cross-sector collaboration isn't, there's a big part of it which is everyone's at the table and they're talking, but there's another big part of it which is just getting people to the table and setting the agenda for what that conversation is. And so in San Bernardino County, we're doing a project with the health department, county health department there. And a big part of that is doing exactly that, setting aside, it's preparing a strategic plan for the county health department and some follow-up toolkits in order to help facilitate the health department to work with healthy communities partners throughout the county. And in order to implement that, the county is creating a position where there's a dedicated position where there's a person whose job it is solely to do that collaboration. So that's just building off of kind of making that happen.
I'll get to you in a second, Dora. So, and then piggybacking on that, the two counties are working together on a healthy development checklist. It's actually, the draft of it is on your thumb drive. It'll be finalized in the next month or two. And that's for every city in both counties, Inland Empire totally, that we could start to look at development with the same lens and evaluate new projects and make that difference going forward. We've worked with you, with, where's Matt Burris? Ramey and Associates to help develop this checklist that can really move us forward at a high rate of speed. Dora, I don't know what you're going to say, but also talk about some of the challenges you face and how we can overcome them.
Okay, great. Well, I wanted to add on something that Eric said because I think that's so important in terms of normalizing cross-sector relationships because, you know, it's not the norm. It's a different mental model and our muscle memory is very, you know, attuned to working in silos. So the importance I mentioned of leadership and, you know, Mike mentioned that, you know, we had the Randall Lewis Health Policy Fellowship, which has really trained and developed new leaders in thinking in cross-sectoral ways, because you know some of the challenges is that it's not the norm. It's in a sense a new mental model. So one of the things, how do we normalize it in terms of it's not the extra work, but it is the work. It's a different model. And then also, you know, if you think about so often, you know, when we were having these conversations and you want to bring all the sectors together, where do you do that? You know, often we'd bring together competitor hospitals or people that didn't normally work together and have different language. But as we begin to build out the Inland Empire, can we think about ways of building space for cross-sectoral work? You know, how do we begin to look at having, you know, it used to be that libraries were places where people gathered and had conversations. Well, where do people gather and have conversations from different sectors to have conversations about building their community? Because, you know, often this really is kind of a social systems change. And one of the biggest barriers, and we're seeing this in our country today, is the polarization because people aren't talking. They're not understanding the different viewpoints and why. You know, if we're really to sit down and have the conversations, and I guess I'm an idealist and I believe that conversations can change the world. And so I ask in our planning, how can we create those venues to have conversations? Because the challenges are going to be, and trust me, you know, people would tease that I should get a shirt with arrows in the front and arrows in the back. Because as I forged through a lot of this work, there was a lot of resistance because, especially in healthcare, if you're competing, you're, taking other people's patients, or God forbid you do prevention in a fee-for-service model and lose money from the hospital with the wrong pocket problem, that's their responsibility. Well, how can we say it's our responsibility to build our communities for not only for ourselves, but for our children? And if we don't start doing things differently, we're going to have the same results. And so we've got to really realize that it's a people and a leadership are some of the biggest challenges. And then there's the funding, but we can work that out. That's going to take some time, but beginning to look at how do we, begin to fund a lot of this work? Who funds prevention?
We're going to fund that because the hospitals will save so much money that'll then be plowed back in the community. Compared to the arrows you might have, Al has 2 or 3 times more than all those, and some of your most innovative ideas have crashed and burned. So what are your challenges?
I don't know of any that have crashed and burned. No. So one of the things that's happening in Riverside right now, in fact, it's happening in about 2 weeks, is our 4th annual Grow Riverside Conference. And it's all well and good. It's largely been focused about our 10% of our land area here in Riverside is permanently protected agriculture, and we're recognizing that we need to use that for all it's worth. Not just to grow food because it's fun to grow food, but it's an important element of a resilient community. Dr. Lucy Jones, who many of you know, she's been doing the rounds in Southern California about this resiliency topic. But we really have to take this seriously, and it relates to public health. It's not just about earthquake safety and will our buildings fall down. But we have to be thinking about how can we here in the Inland Empire produce our own food, so we're not reliant upon countries thousands of miles away for our grapes, or ag areas in the Central Valley that are hundreds of miles away. What if we were stranded? You want to talk about a health problem? No food and no eating is a health problem. Or, so related to that, think about the prospect. There's lots of companies now, commercial companies, that are growing food indoors in a controlled environment. Invite them to your cities, and rather than store a bunch of plastic goods in a big warehouse building, have them convert those buildings into food growing machines. Think about ways to repurpose our land uses so that we can travel less and be more resilient locally. That's one of the things we're doing here. One of the crash and burns that Michael was talking about was a couple years ago, we wanted to do a re-examination of 90% of our commercial, industrial, and office land, much of which revolve around our commercial corridors in the city where there's existing infrastructure. It's called the Smart Code. Well, it blew up. It was perfectly supported by the electeds, by the business community, but what failed was we did not have the funding stream to pay for that code update, that community-based specific plan that Eric was talking about, as shored up as we had thought it was. That created a whole bunch of problems and it blew up. We're still going to achieve the same ends. We have a great general plan right now that was adopted in 2007. We're going to be heading down a path here pretty soon where we're going to update the general plan now that we're in the era of non-redevelopment. And we're going to capture that same vision for a community-based perspective on land use and the zoning to implement it. That was integrated into the Smart Code. We have setbacks. All of us in this room have setbacks. But we still got to figure out the next step to get to the outcomes we seek. So a couple failed attempts shouldn't paralyze any of us. We got to keep plowing ahead and figuring out a different means to the ends that we seek. And with that, I'm going to hand it over to Michael since I crashed and burned.
You still inspire me, even with those. We could talk all day, but we have now, each of you have 2 minutes. I learned this from President Clinton. Dora, if you had the magic wand and anything could happen, tell us what you would make happen.
Well, the magic wand. I've had this concept, I always call it MC squared, of building a place for conversations that matter and having those in every community where we could have collaborative working to bring in the social entrepreneurs, because I see this work as nothing but opportunities where we can build take the millennials. If you ever been to a Starbucks or a Panera, you see these young entrepreneurs working on Wi-Fi on some great ideas. What if we gave them context? What if we began to seed economic development in a social entrepreneur way by building health? That we made health, about economics, and they weren't, a dichotomy, and built our future leadership to say that this is how we're going to do business. If you look at, we often look at a view of scarcity. What if we were to change the mental model to abundance? We spend almost $4 trillion in healthcare. And then, so we are an outlier in terms of how much we spend, but we're also an outlier in the minimal amounts that we spend in social services. But what if we were to look at it from a perspective of there's all those dollars in transportation, healthcare, social services, and we began to build the communities that we want from a lens and a view of abundance.
Thank you, Dora. So, Eric, the magic wand, change the world.
Actually, I think that magic wand sounds fantastic. So, and is in line, just to tie that into the communities have built-in capacity to do that, that in order to make that happen, that there's someone in each city and in each county, in each health department, whose job it is to make sure that keeps happening. So I'm just gonna, I think, add on two things that I wanna flag for people that, for me, I think are important to keep in mind as potential unintended consequences. One is a lot of the disparities in health and in wealth that we see are unintended consequences of how we implement our policies. So let's keep in mind that this idea, there's basically significant demand for beautiful, walkable urban places with open space and activity, but we haven't been building that. So when we build that, we're risking displacing people who are already in those locations. And so to make sure that this vision is inclusive of everybody and doesn't have unintended consequences on certain communities or populations. And then secondly, displacement was one, and I forget the other one now.
We'll come back to you. Al, can hardly wait.
So if I had a magic wand, I think it would tie back to a letter I got in 1999 from Jane Jacobs, who was one of the great urban sociologists of our time. She's now deceased. But in that letter, where she was adding to another crash and burn, where I asked her to write a foreword to a book, and the book happened to be published by the American Planning Association, who I didn't know at the time she despised because of the bureaucracy behind it. But in that letter, she said, think about those places you like to visit. Chances are those places were built before the bureaucratic regulatory machine of zoning was established. So my magic wand ties to that. I'm hopeful that 2 years from now, we'll be back here, and I can say that we've adopted a new zoning area, if you will, that's modeled after the pink zone in downtown Detroit, where basically for this area, almost complete hands-off of zoning. You allow building code and fire codes to drive it, and you have a basic urban design framework, and you allow the entrepreneurial spirit and the talent that is out there today to build these walkable places that Eric and Dora have been talking about. I think we are actually regulating ourselves into an environment that isn't healthy. And we've got to blow it up and see what the entrepreneurial spirit can do.
Eric, you have like 30 seconds because I see Professor Leverage on his way.
Yeah, so the other one was just to keep in mind safety. So we heard a little bit earlier about ACEs and adverse childhood experiences, and I think just generically speaking, when we go with multi-sector collaboration, we need to keep in mind, especially in certain communities that we're talking about, the impact of safety, whether it's traffic safety, whether it's incidences of violence and crime, and the significant impact that that has on health. And the upstream ways that we can address that, which tie into everything that we're talking about here in terms of economic development and jobs and healthy food systems.
And we'd be remiss if we didn't talk about our communities. We need to make sure that everybody in the community benefits from whatever it is we're doing. It's equity, not just for a few, but for all of us. Think about if every child could walk to school safely, that every child could eat healthy, nutritious food that was available for all of us, and that we didn't have to drive alone to work or to play. Professor?
Michael, we have an extraordinary opportunity today to ask questions of these four speakers. So we wanted to devote at least 15 minutes to that opportunity. Jennifer Ward, who is central to having this whole event take place, has the microphone. Pick out people you want to ask, and we should maybe shift generations. This is my age cohort here.
My question is,
Oh.
my question is, there's a huge issue out there of transportation with respect to goods movement. You've been talking about the community and the health in the community, and I've heard people talk about things next to freeways. There is, the ports are intended, as of about 5 years ago, they were going to triple by 2040. 43.5 million containers. Huge amount coming through by trucks, diesel, through your community. By trains, nonstop. How are you guys dealing with that?
Yeah. There is a panel that you recognize at 10:30 which says Future of Transportation, but your answers.
I mean, I think that's a great example of how we can get public health and economic development together, because that's been the history of public health in terms of, how do we ensure that there's the health of the public, but yet, the economic development of, I mean, if you look at the economics, having a job's pretty important, and, that thoroughfare. So, I don't have the easy answer to that, but I think that we need to have those crucial conversations in collaboration. And if you look at what China's doing, I mean, they're building trees on the side of their buildings. So, let's sit down and let's have a conversation about how do we have economic development and face the reality that that's probably not going to go away. You look at, I mean, I buy everything on Amazon now. I don't know if that's a good thing or not, but I mean, but yet how do we ensure that we're improving the health of our communities by future decisions? We know putting apartments and schools next to freeways isn't a good thing for childhood asthma. So how can we be responsible, and where's the and both?
Yeah, I mean, it's a big question with lots of answers, as you know. I mean, one of the things that our council just wrestled with recently was a warehouse project. And one of the conditions that came forward from AQMD Southern California AQMD was that, in order to meet the health risk assessment, the developer had to ensure that nothing older than 2010 diesels were allowed on their premise, right? So that's kind of like from a kind of microcosm, that was that was a solution, for that immediate public policy concern. I mean, there's big issues there. I mean, we're all buying from Amazon. We're creating the demand for the trucks to come out here, right? And so part of it is we're the problem as much as we're the solution. And so hopefully, I mean, it's a big hope, and let's hope it keeps going. Hopefully our transportation modes get cleaner and cleaner and cleaner. The other thing is, I remember former City Council member Steve Adams was advocating, make the trucks drive on the freeways at nighttime, not during the daytime. And have them drive the corridors at nighttime where there's less congestion and thus less pollution, right? I don't know the answer. It's a big question, but we all, I think to Dora's point, we all got to be in the room together talking about it, not just some air quality agency in a silo.
And we're starting to use those shipping containers to build affordable housing. Because you can't get rid of them.
I want to thank you all for being here. It's been interesting listening. As I've been listening to you as speakers and I was listening to the opening remarks, the thing that kind of resonates in my head is this concept of weakest links. Think about a necklace that you wear, and if the one link breaks, the necklace is no good until you fix the link. On a baseball team, your pitcher is starting to get worn out, so you bring in the relief pitcher. You're replacing that weakest link to continue to make yourself strong. So when we talk about the future of community design, I was just interested in what you guys are thinking about. Where do you invest your time and your effort and your money? Do we fix the weakest links in our community? The barriers between freeways and arterials, the underperforming communities, the lower performing schools, the areas where you're talking about health and you're talking about safety and you're talking about education is key. It seems if we don't invest in the weakest link, we're not going to fix anything. But a lot of communities gravitate towards investing in the higher successful areas of the community, and they forget about the weakest link. So I'm just curious, in this future of community design, how you all feel about that.
The issue on weakest link, it's ironic because we know that the key to lifelong health is reading at grade level in third grade. Think about, and education is key to health, and it's key to solving many of our issues, yet the health department has so little to do with education. Yes, we can help people eat healthier, but this is where we have to really bring in those partners that Al was talking about, really bring in the whole community to help us. If we can educate people properly, then maybe that's our weakest link, and it's not really the development piece. It's making sure we have a well-educated, healthy workforce.
I would say a couple things about that. First, in terms of magnitude of impact, is kind of the way that I think about it. So one way to do that is to focus on younger generations because you get the benefits over their entire lifetimes and you change their behaviors and the way that they think so that that then passes down to their children. So you can generate more change when you're working with someone who's younger than when you're working with someone who's older. So there's more room for change there. And then secondly, when you look at historic policies and the impacts that they've had on health, when you look at data of where the greatest disparities in chronic disease are, when you look at any number of different indicators, violence rates, traffic injuries, they tend to be concentrated in same geographies. So if you just for every community is going to be different, and those indicators won't always be exactly the same, but it's not always too difficult to find where those areas are, and then again you can make the greatest change in the areas that have the furthest to go. And so it's not always going to be, you don't necessarily need to start with the same thing. You don't want to get overwhelmed. You can't do everything all at once immediately. So pick something that you have community support for, or pick something where it's really clear that you have a long way to go, and find the area in your community where you can make the most change there, and then start with that one thing. Schools is one of them. Job access. You could have an economic development lens that you go in terms of improving not just that geography, but also the people in that community, in that part of your community.
And just real quick, I think one of our weakest links is how we all move around in our local communities, right? The majority of our trips are, within 5 miles of our house or less. And yet we hop in the car, most of us, to drive. And that just, as we know from data, that just creates more and more of a sedentary lifestyle. And we also know from data, I mean, USC and Marlon Bournet has been doing this work for a long time. Those communities that have, in this case of Marlon's work, with light rail, for instance, the health outcomes improve dramatically once that light rail gets going, because people are walking to and from, right? And it's fantastic. And so here we just spent $1.5 billion improving our freeway, which is great for me because I commute in every day from Orange County. But what does it do to the citizens of Riverside in their public health outcomes? I'm not sure it does anything.
Could I just intervene with a question maybe to Michael? Is that I have a Fitbit on. I often find myself when I have meetings, people also have Fitbits. It's a quest for 10,000 steps a day. What difference do Fitbit? It's made a difference in my life, my wife's life. Could you comment on that one innovation in terms of health?
Well, like everything, if you measure it, it can make a difference. And sometimes just talking about things makes a difference. And if you have your Fitbit or your equivalent, Wendy's a marathoner, she has a different fancy device. But if you track what you do every day, it makes a difference. If your goal's 10,000 steps, and then you're going to try and reach it every day, and that can make a difference. And I can decide for some people in my family, it turns out they were doing like 3,000 steps a day. I gave them all Fitbits. Now everyone's doubled that. Nothing changed except it's conscious that they're doing that every day. And I know for those with Apple Watches, it also tells you to stand up and stretch every hour and drink water every hour.
So I agree with that. But here's the deal. Kaiser Riverside Hospital just did its health assessment for its service area. Goes down to Temecula, goes to Idlewild, Riverside, right, the desert. 36% of its service area is living in poverty. Those folks can't buy Fitbits. I'm sorry. I mean, it's a great thing for all of us who have means. It's not a great thing for people who are poor. And those poor people are the people that have the greatest health challenges. So Fitbits are great, and I believe in them. But I also believe we got to be taking care of the people who are economically disadvantaged in our region.
I think we have time for one more question right here.
Thanks for the great panel. I'm Nader Afzalan from American Planning Association Technology Division. I'm interested in connecting cities and healthcare organizations, and especially thinking about ways in which we can connect patient engagement and citizen engagement activities. So what's your insight on that?
Well, in California for years, we've had to do a community health needs assessment every 3 years and then some type of community health plan. And so this is your greatest way to really engage with your local hospital, to be a part of the community health needs assessment, and then call and ask them what are they doing about with other sectors, and what's their community health plan, and how can you be a part of that. And I think this is happening all over the country, and so connecting with that community health improvement is perfect. And I can guarantee you, that's why my business is flourishing, is that hospitals are having to learn how to live outside the walls of the hospital. And just recently, San Antonio Regional Hospital opened up the Healthy Communities Institute. One of my major clients is Providence St. Joe's Health, and so throughout the entire health system, we're encouraging our community benefits leaders to reach out to other sectors that are really impacting health. Because, back to the weakest link comment, in healthcare, 5% of our patients, accumulate 50% of the cost. And so, we're always looking at this upstream. So it's a really and both. If we don't address the health disparities in our country, we're never going to gain the advances of health. but we also need to look at a coordinated way of building upstream approaches to really what's impacting the 5%. So reach out and get involved in the assessment of the health of your community.
And both Riverside and San Bernardino County's Departments of Public Health have finished their community health improvement plans, and that's one more piece I think that you could be involved with as we work to improve both counties' health at the same time. The priorities are similar but different, and then work with your health department. Right. ShapeRivco.org. There we are. And you can get all the data that you need for your communities and see what we're doing.
Yeah. Before we close, in terms of the connection, there is one national sort of best practice that Dora in part was at the beginning of. We mentioned the name Randall Lewis, who has been talking about health when he was really kind of an outlier. He was almost by himself. And there is this Randall Lewis Health Fellowship Program, which is really a connector program. And Dora, in many ways, was the inspiration and genius behind this. So tell us a little bit, because I think we've introduced the fellows without really explaining what the program is. If you could comment on that.
Well, it's really developing the next generation of intersectoral leaders. So it started in 3 cities, and with Loma Linda University and Claremont Graduate University to take individuals that were learning about the Masters in Public Health and working in the healthy cities to help them with the multisectoral initiatives. It's grown now, Maggie, forgive me, 11 universities, and I think we have well over 45 sites throughout Southern California where the students are placed and really learn, how do you lean into this space? How do you have these conversations? And so as I mentioned earlier, we have over 135 alumni that have graduated from this program, and they're living all around Southern California. But it really is a leadership development to learn all about this. So there are next generation leaders, and I have great hope and confidence that that these conversations will get a lot easier.
We're about ready to have our break. I'm sure the panelists will stay here for individual questions. Jennifer, you want to make an important announcement?
Yes, we're getting ready for a 10-minute break, but I just want to remind everyone, if you haven't had a chance to drop your business card in the box at the registration, we'll be having a raffle announced at the end of the conference, so make sure you stick around after lunch. We'll be raffling off a $500 gift certificate to a local bike shop here in the Inland Empire, as well as a pair of tickets to the Grow Riverside Conference, which is the event Al was talking about. So make sure you stick around, and thank you again to our panelists. Please join me in giving them a round of applause.
Coffee, drink is in back, fellowships in front. All right.
there might be a better way. You have